I don't think anything we do that fails is a waste of time. We can always learn something from that, and I think those tough times in the Fitch lab that first year taught me that things would get better, that we would gain insights, and I learned a lot about methodologies and techniques during those years. I think if there's one thing I'm disappointed in, it's still not having had a fantastic impact on therapeutics in rheumatic diseases. I think, some of the most exciting things I've done in my career is to sit on scientific advisory boards of a couple companies that developed therapeutics that are now FDA approved. And one in particular, which is pretty well known, it was on the front page of the New York Times recently, is a drug that treats melanoma. And it targets a signaling enzyme a little bit like ZAP70. It's a kinase, and it turns out in about 50% of melanoma cases, a mutation in this kinase activates this kinase, and it plays a major role in driving disease. So a small biotech company that I was on the SAB of called Plexicon developed an inhibitor against this kinase. And when we saw the results of the phase 1 trial, we all had shivers up our spine, I think, because we were looking at penicillin for cancer. These people had hundreds of lesions on their PET scans, and within 2 weeks of therapy, the lesions were gone. That drug went from initial beginning of work on that as a target at Plexicon to FDA approval in 5 years, which has to be almost a record. And it's approved now, helps about 50% of patients with melanoma. It's not a cure, but it prolongs survival 2 to 3 years. And, or 2 to 3-fold anyhow. Sometimes that amounts to 2 or 3 years. But it was only used as a single agent, and their resistance develops to the therapy, and we're hoping that combination therapies will result in cures. But it was so dramatic, and to have that experience in a setting of malignancy was just really awesome, and I'd love to be able to do that with autoimmunity, and maybe we'll get somewhere with the ZAP70 inhibitor.